Hey guys, and welcome to this unconventional piece that we're doing here today. So we're doing kind of a, talk show interview kind of setting here today where we're going to answer a lot of your FAQs. We get questions on a weekly basis. I know Crunch gets them a lot on his podcast as well. A lot of you that want to fly someday, that's a lot of our dream career when we get into EMS or a lot of our ER and ICU nurses. But we don't know where to start. A lot of you have so many questions. What experience should I get? Things like that. We've compiled a huge list, and we're going to address all of those today here in this interview. So my name's Gwenny. I'm the Director of Education here, but I also fly PRN, and I still work in the ER PRN. And next up, Von Ron, you want to introduce yourself?
My name's John Von Rosenberg. Most people call me Von Ron. I am a flight paramedic in North Carolina. I've been in flight for about 15 years, and I did EMS and fire and ocean rescue before that. I'm one of the instructors here.
I'm Mike Caruncio. I'm an instructor. I have over 20 years in EMS, and I fly and I work as a regular pre-hospital paramedic also.
But it's kind of cooler than that. You work a fly car.
By myself. I have the best partner ever.
You want to tell them like what that is? Because not all the agencies have like critical care fly cars.
It's a two-tiered, it's not a critical care fly car.
Oh, okay.
It's a two-tiered ALS BLS system. So dispatch asks their 400,000 questions, and then they triage it appropriately-ish, and they dispatch whatever resources they need. So they'll send the BLS from the fire department, and I will respond in my fly car.
Very cool. Is it like an SUV just loaded down with everything you would ever need?
Yeah, but we've pared it down. That's been a big initiative of mine this year.
Yeah, I made a meme that did not go over well in the industry a few months ago. That was, the guy sitting at the table with the cup of coffee and has the sign and it says, "Change my mind." And I said, overstocking is the same as understocking. Change my mind.
It drives me insane. I went through the bag and there were 3 crate kits in the bag. I had a meltdown.
That's a bad day if you're using 3 crate kits.
That's what I said.
Oh, goodness. All right, so one of the first questions that we get so often from our viewers and our listeners is, how do I get into HIMSS? Where do I begin? How do I even start to get my foot through the door?
Well, there's the interview type job stuff, like, most programs require you to have 5 years good pre-hospital experience or nursing experience. For the nurses, you could probably speak better to this, but it tends to be ER, ICU that have the most marketability. But honestly, it's networking and developing a good reputation. When we interview people and we look at the applications for openings we typically know who's going to apply. And unless it's from somebody out of the area, as everybody knows, EMS is a small industry nationwide. We all know people from all over the country. We're all connected. It's not 6 degrees of separation, it's 2 degrees of separation. So we pretty much know the person that is applying most of the time, or we can find out. So networking is key in that respect. So it may not be the interview HR appropriate answer, but it's really who you know and getting a good reputation out there.
Absolutely. I would agree with that as well, that, as a nurse, so they're both paramedics, I'm a nurse. For the companies that I have flown for, it's a bare minimum of 3 years. If you're going to fly in a CAMES accredited program, and I would recommend only looking at CAMES accredited programs because those companies do have to maintain those high standards, they require a bare minimum of 3 years, like Crunch said, good experience. If you're working at a service that does, 1 call per 24 hours, they're probably not going to look at you. You need to be maybe looking at transitioning to a job where you're going to get some high volume experience. But most places like 5 years, the place that I'm flying currently, they require 5 years experience in critical care. So they only take from the ER and the ICU, and they really prefer their nurses to come with both. I just kind of skated by that rule because I had already flown before, and so I don't have any ICU experience. I'm just an ER nurse. And then as well, we have to have a lot of certifications.
Yeah, so I would say that as whatever level provider you are, you have to have the certifications that go with that level. So if you're a medic, you have to have your medic certification, you have to have your state, and then whatever states you service, depending on where you are. And then everything that goes with it, ALS or ACLS, BLS, PALS most commonly. some kind of trauma certification, and then the specialty certifications. I don't know if that's a separate conversation to get into, but usually they either want that or they want you to have it within 2 years. So some places, if you have it when you apply, that's kind of a leg up. Nurses, I think, are the same. Basically everything that goes along with nursing. The ones that get people to make sure that you have, if you don't already, some kind of trauma certification, and then that NRP, that neonatal certification, is kind of difficult, especially for the medic side of things.
Yeah, most of us nurses, when we work in the hospital, we take ENPC, but that doesn't apply pre-hospital, and so I had to go get PALS on my own before I could even apply for my first flight position. And so for my first flight job, we had to have, before we even started, BLS, ACLS, PALS, TNCC, PHTLS, NRP, our multi-state license, which it's so much easier. I always feel so bad for you medics having to renew in, a bajillion states if you practice in a, how many states do you cover with working here in the Northeast where the states are small?
Right now, 2, but at my previous program, I was certified, licensed in 4, and that was a pain.
How close to the border are you? Down in North
Pretty
Carolina?
close, yeah. So I have 2. I have in
Okay.
North Carolina and Virginia, and then my registry too, which helps.
Okay. And then if you are going to work for a larger company, not just, a small hospital-based program where they have 1 or 2 bases, but, a nationwide company. My husband works for a company that flies in multiple states, and so I think he has like 6 states where he's got his medic license. But, just to touch on something that you mentioned earlier, most places, the CAMES requirement is that all the flight clinicians get their advanced certification. So for medics, it's your FPC and your CCPC, or one or the other. And for nurses, this is a new rule. This actually just came out January 1st of 2023. They used to accept the CEN, the Certified Emergency Nurse, and the CCRN, the Critical Care Nursing Advanced Certification. But the preference was for CFRN. Now it is a requirement. It has to be that CFRN. They no longer will accept the CEN or the CCRN. So you've got to get that CFRN, which we sell a review course for that. We would be happy to help you pass that CFRN.
Can I say something about the FPC?
Yeah.
So I get tons of DMs from people that follow my podcast that say, I want to take the FPC. What do I need to do to prepare? And of course I say take our course. However, I would tell people that unless you are in a critical care environment, that I would hold off on taking the FPC, because this knowledge is use it or lose it. Paramedics in the field are not looking at A-lines. They're not looking at hemodynamic values, ventriculostomies. So that knowledge is use it or lose it. So I get a lot of people that want the letters after their name, and they're like, oh, it would be a good certification to have. But unless you're going to be able to conceptualize that information and apply it on a regular basis, I don't find a whole lot of value in just having the letters after your name, unless you are applying for a flight team, and there are some programs that really want you to have it when they apply. But most programs, at least that I'm aware of, will hire you and give you 6 months to a year to get it. And I think that approach is better for people, because they're seeing the ICU stuff that you don't see as a paramedic in your everyday practice. So we have great paramedics that come and start working for us. They're phenomenal street medics, but once they get into the hospital, they're like, wow, what is all this stuff? It's a different world. So I think that you can learn that stuff. You get into a flight program, you get used to the stuff you're seeing, and then prepare for your FPC, because it's really, that knowledge is going to get burned into your head. You're going to become a better paramedic. You're going to become better at your practice. And I think it's more useful that way. Because we all know those people who have, like a lot of administrators, who have 17,000 letters after their name and not one iota of clinical acumen that they bring to the table.
Yeah, they can't set up an IV pump to save their own life, much less the patient's. I think it's the difference between knowledge and then the application of knowledge. Mm-hmm. So a lot of people can take the test and then pass the test, and that's valuable in one sense, but then if you're unable to apply it, then it's significantly less valuable. So if the place where you want to go has a requirement that you have this prior to your hire, then that's an option, and you can certainly prepare for it and take the test. But I don't think you would be able to use that knowledge unless you're actually using that knowledge, which seems obvious, but maybe less so than we think.
Yeah. Have you been part of hiring committees? Both
Yes.
A while, yeah.
A few dozen, hundred.
Oh, I was going to say a while ago, but
What stands out to you on resumes from candidates?
some time at a place makes a difference. Like Crunch mentioned, that we know you or we know people who know you, and any, if we just simplify and refer to flight services, if a flight service is looking at you as a candidate, I imagine that they, or through some other avenue, someone they know is going to go and ask about you. And so the reputation that you have in the surrounding areas is going to be a big factor in that. So have you been somewhere? Have you been somewhere for a little while? And have you established a positive reputation there? If you're doing the work, if you're showing up on time, if you have a good reputation, if you get along with people, all of those are really good signs. And that would be one of the first things that I look at when I'm like seeing a name floated as a potential hire, is like, what's their reputation out in the world right now?
There's also a lot of fluff that you see on resumes. I think people get wrapped up in, they want to put everything on there. Like we were joking before this that my wife is a nurse practitioner, former paramedic, ER nurse, boss at her job, and I told her, you can probably take the bagel shop from high school off of your resume. So if your resume is 3 pages and it's got all fluff and stuff like worked in a progressive environment responding to emergencies when people call 911. Well, I know what a paramedic does. You don't need to tell me what the definition of a paramedic is. So your resume should be short, 1 page. Also, there's a lot of stuff that people pad the resume, and you can see through that, and it's kind of like, what's the point of putting that on there? Like, I just looked at a resume last week that had, well, I'm a stop the bleed instructor. It's like, I don't know if people know this, but all you need to do is submit that you're a paramedic to the stop the bleed people, and they automatically send you a thing. So there is a lot of fluff, but like Von Ron said, it's all reputation. Like I left one flight job for another flight job, and I had a good reputation at my last flight job. So if they see Mike was at blah blah for 7 years and now he's applying to the next team over, why is that? You may have a perfectly good reason for it. It doesn't mean that something bad happened or that you were going to get fired. There may be a perfectly valid reason, and having relationships in a small community, we could talk to people and find out, well, hey, they actually have a really good reason, and maybe they're a great employee and the company wasn't treating them well and they're looking for somewhere that's going to be better work-life balance, things like that. So that's kind of the stuff that I consider. I don't like to look at the resume. There are old school managers who get laser focused on that resume. And it's like, no, you got to ask around and do some detective work.
I was waiting to say, I have been a part of a handful of hiring processes as well. I never look at the resumes. All I want to do is find out what their work experience is and then go ask around and find out about them.
And the interview is great, but the interview if you ace an interview, that only means that you know knowledge and you're good at BSing your boss. I mean, how many times have somebody been hired, they're like, they were awesome in the interview, and they show up to work and during orientation, people are going, OMG, how did this person get hired here?